President, Heart Care Foundation of India and Group Editor-in-Chief, MedTalk. Welcome to our webcast on an important subject, which will talk about gluten sensitivity, which will talk about wheat sensitivity, wheat allergy, wheat hypersensitivity. Do everybody need to produce gluten in his diet? Lots of questions will come and we will answer. I have with me Dr. Tom O'Brien, who is a functional medicine expert and is also on the chair of the international conference called ISWT. I have with me Ishi Khosla, the top nutritionist of the country, who will also be talking about all these aspects and who is an important person in the country, a crusader in the field of the word gluten. And shortly we will also have Dr. Sharad Chandra, a pediatric gastroenterologist, joining us from other part of the country and who is the organizing secretary of the conference. Hello everybody. Hello Tom and hello Ishi.
Hello.
Hello.
Hello. Let's talk about to you, Tom. When you say you are a functional medicine expert, what is this functional medicine?
That's a very good question, and I'll give you an analogy. When I'm teaching on stage for doctors or for the general public, I use this analogy. When a patient comes to see a doctor, if they've been diagnosed with a disease already, such as diabetes, it's like, and so they're coming to see this other doctor to look for another approach to help them with their diabetes. It's like they have fallen over a waterfall and they crashed into the water below. And they swim up to the surface and they spit the water out and say, thank God I'm alive. Thank you, I'm alive. And they're trying to stay afloat in this pond of diabetes, or this pond of rheumatoid arthritis, or this pond of recurrent miscarriages, or this pond of infertility or migraines. It doesn't matter what the symptoms are. They've fallen into the pond. And everyone's trying to stay afloat, but the water is so turbulent because the waterfall keeps falling into the pond. And the water is very turbulent when you're in the pond of diabetes. So we have to find a life jacket. The water stays turbulent because we're still living the lifestyle that caused the problem that eventually developed as diabetes. We're still living that lifestyle. Everyone wants a life jacket to stay afloat in the pond of diabetes, or whatever their pond is. And we want the safest life jacket. So you try the natural approaches first, if you can. And if they don't work, you take the medications. Take the medications. But once we're safely afloat in the pond of diabetes or migraines or whatever it is, you don't stay you swim over to the side, get out of the water, walk up the hill, walk back up the river and figure out what fell in the river that carried you downstream and you fell over into the pond of diabetes. So functional medicine, the term is going upstream. For example, we take the history of the patient. What was their mother's pregnancy like with you? How was the birth process? Did your mother have any medications during birth? Did a natural childbirth or were you breastfed? 3 to 5 days of mother's breast milk is colostrum. It's not milk. From turns on the genes in the gut. There are problems later in the life. The science is very clear on this. The idea of functional medicine is to get the history and figure out what happened here that caused the person eventually to manifest with the disease that they have.
Fabulous.
Thank you. There's an aspect of function. We are organizing a conference in November, which will have a lot of sections on function. Today we need to discuss about the word gluten is affecting only 1% of the population 99% of the
to describe the Krishnas are coming in the form of celiac disease, which is a known entity in that is atrophy, which means to an extent that the absorption surfaces in the gut get destroyed, and it could lead to absorption of nutrients, and then several other, you're more vulnerable to several other disorders and diseases. Celiac disease is something which is not new, and it is an organism in itself. The challenge right now with celiac disease manifests itself in many ways which were not understood earlier and are not a part of medical textbook description, and in fact also referred to as a childhood disease, where actually the average age of diagnosis of celiac disease is now about 45, midlife, 60 years. So that is something which is distinct. However, I think if you look at what is happening today, the 99%, the issue is more gut related, and as Tom rightly pointed out, that we need to go back to how our mothers ate and what we were exposed to during, in the womb, and post that, those critical, the window of opportunity, as we say, the 1,000 days, what happened in those days, and then what kind of exposure we are getting in our diets, in our environments to toxins, and therefore go back to what really happens is in the gut. So if you look at the gut issues and how we are quite different from our ancestors in the way our gut is today, that means our gut lining, the intestinal mucosa, and those changes are making us vulnerable to food sensitivities, among other things, and hence the issue of gluten is coming up. And it could be gluten, it could be dairy, and many other foods.
So Tom, internationally, what will be the level of gluten sensitivity and what will be the level of wheat hypersensitivity? If I see, just like I would like to compare it India versus others.
Those are very good questions. And at the International Conference on Wheat-Related Disorders in New Delhi in January, we will have world experts talking on these topics. The first thing to say is that there's a consensus in most countries of the world that celiac disease is somewhere between 1% and 4% is the high. There's a couple of countries of Africa that are as high as 4%. And we think that's because, of course, they're genetics, but they also are eating couscous in most meals during the day. And so they're getting a lot of exposure to one of the wheat derivatives. So it's 4% in a couple of African countries. But most countries of the world, it's 1 to 2% of the population will have celiac disease. But a wheat-related disorder, depending on the studies you read, can be anywhere from 6% in some studies, so 6 times more common than celiac, up to 20%. Some studies identify 20% of people who are checked will have an immune reaction to wheat, and they're fighting wheat. And the way we describe this to our patients is, Mrs. Patient, if you pull at a chain, the chain always breaks at the weakest link. It can be at one end, the middle, the other end. It's your heart, your brain, your liver, your kidneys. Wherever your genetic weak link is where the chain will break if you pull too hard. Well, when you have a wheat sensitivity, you're pulling on the chain. And so the manifestations of a wheat-related disorder are very, very often outside of the gut. Ishi is exactly right that the treatment protocol to help stabilize a person must include treating the microbiota of the intestines and healing intestinal permeability in the intestines. So we must focus on that, but the symptoms that someone may come in with may be anywhere in the body, wherever the weak link is in the chain. That's why sometimes people who have skin problems, when they stop wheat, their skin problems go away. People who have lost their hair, when they stop wheat, their hair starts growing back. People with arthritis, when they stop wheat, their joints feel better, they're functioning better. That there's no system of the body that may not be affected. So you cannot just look for gut symptoms. Some studies show for every patient with a wheat sensitivity that has gut symptoms, there are 8 that don't have gut symptoms. The symptoms are somewhere else in the body. The Italians call it a lack of well-being, meaning that you hurt somewhere else outside your gut. So the ratio is 8-to-1, that a wheat-related disorder may manifest somewhere in the body, and it's 8 times more often than a diagnosis of celiac.
And I think that's why we yeah.
I'm saying in your conference, when you are organizing in India on wheat disorder, if it is true that 20% of the people may be wheat sensitive, that means if 1,000 people attend, but 200 people you will have a special counter called a gluten-free diet in your conference?
Everything will be gluten-free. We are going to have...
Everything will be gluten.
Yes. In fact, that's the reason why ISWD 2019, the theme is beyond celiac and beyond the gut. That's exactly why we...
So you will be basically having a meal which will be a gluten-free, and you agree that in all marriages today we should promote that there should be a separate section called a gluten-free. When you can have a Navratra section, when you can have a festive section, you should also have a gluten section in every meet, in every marriage function.
Well, I think after the ISWD, I won't be surprised. I hope that happens.
Okay, Tom, I'm coming back to you. When we talk about we talked about sensitivity, we talked about this. Now, what are the, suppose a person is a gluten, he is a celiac negative, but gluten sensitive. What should be the lifestyle?
Just yesterday, I received notice that an article I had written will be published in the Journal of Gastroenterology and Hepatology. And they sent me a copy of it, and we will make a copy of this available to every registrant to our event, to the symposium. But this article is a review of 3 pediatric wheat-related disorders. One is a celiac child diagnosed with Kaposi sarcoma, a conjunctival tumor in her eye. And it was completely reversed on a gluten-free diet. Completely reversed. As a matter of fact, I am so happy with how the publication came out. I will try and show you the picture here. This is from the study. We can see this. The top picture is the little girl's eye. They pulled the eye down. She's looking down, and they're lifting up on the eyelid. And you can see this tumor in the eye. And it's above the eyeball, the upper part of the eyeball. And they diagnosed it as Kaposi sarcoma, which comes from HIV, because mom was HIV positive. But when they checked the little girl, she was not HIV positive. So they said, well, wait a minute. If this is not HIV positive, what is this? We don't know what this is. Mrs. Parent, we have to do a biopsy of your child's tumor. So we'll put her under a general anesthetic, and then we'll take a sample of the tissue to find out. And the parent said, oh, no, no, please, please. Our daughter was just diagnosed 1 week ago with celiac disease. And when the doctor put her under a general anesthetic to put the tube down her throat, she had a sensitivity to the general anesthetic medication, and she's not gotten better yet. She's not completely better. So please, can we wait a week? Can we come back next week? Will not hear a reaction to going under a general anesthetic again. So the ophthalmologist said, okay, fine. So the parents started the child on a gluten-free diet. And they come back 1 week later to the ophthalmologist to do the biopsy. But the doctor takes a look at the eye and he says, well, wait a minute. And he pulls out the picture that he had taken 1 week ago, and that's the first one that I showed you. And then he said, but wait a minute, we're 1 week later now, and this is what it looks like. The tumor is getting better. So he said, let's not do any surgery. Let's just watch this. And within 2 months, the tumor was gone. Gone.
Wow.
No other treatments. So sometime, depending on where the weak link in your chain is, will determine where you manifest the symptoms. And I'll show you another child, because I did 3 children in this study. The first child had diabetes, and the parents asked if there were anything else that the office could do. And the office was about to begin a study on a gluten-free lifestyle for children with diabetes. So I said, if you want, you go gluten-free. So this was a 6-year-old child, and they put the child gluten-free, and this is what happened to the child's hemoglobin A1C compared to all the other children. The hemoglobin A1C, you can see, is much lower than the other diabetic children, just by going diet. Because wheat, if you have a sensitivity to wheat, and oh, by the way, they took the child off of insulin, and they said this child's not diabetic anymore. And they monitored the child, and this study, they monitored him for a year, and then they published the study. So in this study, it arrested the autoimmune disease type 1 diabetes. So the point that I'm trying to make, and we will make this study available to everyone who registers for the symposium, the point I'm trying to make is that your symptoms can manifest anywhere in your body, anywhere. And so when I show the study, I say to the doctor, so doctor, what will you say when your patient comes in and says, I've been diagnosed with a conjunctival tumor and Kaposi sarcoma? What will you say? And you'll say, advice of the ophthalmologist, definitely, but let's also check you for a sensitivity to wheat. And your patient will say, what? What? I said, no. I saw a research study that sometimes, rarely, perhaps, I don't know how often, but certainly in this study, it completely reversed a tumor in the eye, or it completely reversed diabetes type 1. So the symptoms are not just celiac disease. There could be many other symptoms. That's the first part of the answer to the question. The second part of the answer is about the testing. Mrs. Patient, proteins are like a pearl necklace. Hydrochloric acid made in your stomach undoes the clasp of the pearl necklace. Now you have a string of pearls. And your enzymes made by the pancreas, by the liver, by the microbiota, your enzymes act as scissors to cut the pearl necklace into smaller pieces of the clip, snip, 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 until they're so small, just one pearl of the pearl necklace. And that goes right through the walls of the intestines into the bloodstream. It's absorbed very easily. And our bodies use those pearls or the pearl necklace, they're called amino acids. And the body then uses the amino acids as building blocks. But the protein has to be very small. The problem with wheat, and we will show you at least five studies that show you the problem with wheat is that no human has the enzymes, has the scissors to break wheat down into each individual pearl of the pearl necklace. No human. Whether you feel sick or not when you eat it, what you can do is break it into clumps of the pearl necklace called peptides. And there are 62 clumps of the pearl necklace, 62 different peptides of wheat that have been shown to initiate an immune response. 62. Now, most laboratories check one peptide called alpha-gliadin. It's a very important peptide. It's the most important one because more than half of celiacs have a reaction to alpha-gliadin. But the other half do not. They are having a reaction to other peptides of wheat, not alpha-gliadin. And so if your test only looks at alpha-gliadin, when it comes back positive, you have a problem. But if it comes back negative, it does not mean you don't have a problem because you're only checking one peptide. And there are 62 that may trigger the immune response.
So that's a very good understanding and a new point which I have learned today that there is an explanation for, a scientific explanation for test negative, celiac test negative, but yet you are gluten sensitive. Ishi, can you now summarize a lifestyle for a person? Forget about the testing. Okay, I'm not talking about whether he is celiac negative or celiac positive, but if he shows some signs of gluten sensitivity, what should be the lifestyle?
Okay, so I would just address that in a minute, but I was very happy to, the case study which Tom mentioned. I have two patients, and one is a recently diagnosed type 1 diabetic who is also off insulin. And his doctor is completely
astonished,
surprised and wants to watch and presents the case in a scientific forum. And so these are real and they are happening and it's not a myth. And yes, now what is the lifestyle? The first and foremost is that we have to respect what we call the grain science as strictly as we do in celiac disease in terms of elimination. There are certain grains which need to be eliminated, which include, of course, wheat and its derivatives like white flour, atta, that's atta maida, suji, couscous, rava, different names of this, porridge, dalia, and some, of course, barley, which has gluten, and some grains which actually do not contain gluten, but for the immune system behave like gluten, and these include corn and oats, and also to a large extent soya. And these grains actually, even in my practice, in my experience, if by mistake, if a patient consumes these grains on a gluten-free diet, does have similar reactions. And there are other grains which I'm not going to mention right now, but those are a part of my clinical experience. And of course, the issue of dairy is huge. I believe about 50% or more people who have this sensitivity are also sensitive to milk protein. I'm not talking about lactose of course, but more importantly, casein. So you have to figure that out. Whether if it's a child, how far you go. If it's an adult, it's easy to ditch milk. But we also need to understand that India is a vegetarian. I mean, we have a lot of vegetarians. We need to address proteins, etc. But yes, dairy needs to be advised case to case. But if you take out dairy, it really is not a very, it can mean that you need to plan the diet more carefully with respect to the other sources of calcium. But if you are sensitive to dairy and you continue to take it, it is going to hurt you and will not give you what it's supposed to do, what it's supposed to, do for your bones and your skeletal system. So, that's dairy, and then of course address nutritional deficiencies, which means that you replace all the nutrients which have been malabsorbed, and support the gut with. We have to add gut supportive elements like probiotics, and but all of this should be done under supervision of a qualified person and not the individual himself. Things can be good and bad depending on how they are done, and of course manage stress, manage their the general lifestyle, and as far as possible go organic, because one of the key issues with food sensitivities is the use of pesticides and heavy use of toxins in our environment. So yeah, it's a holistic approach. Just one thing or one approach is unlikely to be enough.
I
Tom,
just
would
want
you
to
like to
ask.
add something here?
Yes, Tom, I want to ask you one question is, should once in a week, there is an Indian tradition of doing a fast. Should everybody should talk about once a week gluten-free, casein-free fast?
I'm sorry, could you say that again, please?
I said in India we have a tradition of fasting once in a week.
Yes, one day a week.
How about fasting gluten-free and casein-free fast once in a week for everybody?
Well, if you put less gasoline on the fire, but you're still putting gasoline on the fire in the week, you're still going to have a fire. So, well, is it okay? Is it good for me to throw less gasoline on the fire? Well, sure. But, if the rest of the week you're still throwing gasoline on the fire, if you have a sensitivity to wheat, and
no,
you eat,
I'm talking about those who do not have a sensitivity to wheat. I'm talking about no celiac disease and no wheat sensitivity. Normal population who is not wheat sensitive, should they observe once in a week a gluten-free, casein-free diet?
that would be beneficial in that for many people, when they do that, if you have no wheat and no dairy, or I'm not sure one day is enough, but certainly 3 days of no wheat and no dairy, what the vast majority of people will experience is it's like a dimmer switch for a light. All of a sudden, the light is brighter. The dimmer has been turned up higher. Or their energy is a little more, or they sleep a little bit better, or the mucus is less. That it takes about 3 days for most people to notice a change. I'm sure a change begins with 1 day of being gluten and dairy free. I'm sure there is some change, absolutely. But the accumulative benefits in my clinical experience usually take about 3 days.
Okay, and what about Ishi, when we talk about Indian Navaratras? I think Navaratras are gluten-free for 9 days.
That's right, absolutely. We use alternative grains, and a lot of my patients come back and feel that those days we felt much better, we lost weight, we had more energy. But again, I must make an important point here. When you say fast, what do you replace when you have a fast? So if you're going to be eating fried food and you're going to be eating all the bad fat, not eating enough vegetables or fruits, I think the whole reason to fast is lost. So yes, elimination is one thing, but what you replace, even where we have paranthas and all of those puris, that really doesn't, those thalis that we eat, unless and until we replace it with adequate vegetables, even if they are different vegetables. In Navratras, we have a restriction on the kind of vegetables that are consumed, but they must be consumed in the right amount. And you don't have to make meals 3 times a day. We need to be definitely giving digestive rest to the body. And that's the real ethos or a principle or philosophy of a fast. So alternate between and reduction in food, and of course plenty of water and yeah.
I think we are short of time. I'll ask Tom to summarize the whole thing in 5 points, and then another 5 points by Ishi before I summarize. Tom.
Okay, thank you. I'm very excited to be a part of the International Symposium on Wheat-Related Disorders, Beyond Celiac Disease, Beyond the Gut. We are bringing the dream team together from all over the world, from India and New Zealand and England and Israel and the United States, that these experts who are coming in to present are the world experts in their categories. And I believe that with this information, with this dream team, that the attendees are going to walk out and be overwhelmed with new information. And during the event, they will be taking pages and pages of notes. And we are going to make the research studies available to everyone who attends. If the speakers talk about a research study, we will make it available to you. Because our goal here is that everyone in the next 6 months or a year spends this much time, just a little bit of time every week, and just learns a little bit more, because you can't learn this all at once, all of this new information. And it's overwhelming, some of the concepts that you'll hear about the new science. And so we'll give you the research articles, and if you take 1 hour a week and just read a little bit more, in 6 months to a year, you are a doctor, you are a healthcare practitioner, or you are a patient, and you really know this. And you know how to take care of your body, and your body is functioning much better than it has in a long time.
Okay, Ishi?
Absolutely, I agree with you, Tom. We're really looking forward to this event and having you all over and hosting you and making history. I like to use these 4 Gs. Gut, it's a gut feeling. So gut, grains / gluten, glucose, and just watch out for these gut, gluten could be grains, and glucose means sugars, and listen to your body. And I think if you're able to address all of these, they're all interconnected, I think you're going to be on the right track. So we look forward to having you in ISWD 2019 in New Delhi, and thank you for listening. Thank you for having us, everyone. Thank you, Tom.
Let me summarize for our viewers that this was a live webcast linking it to International Symposium on Wheat Disorders in the month of 2019. And we have the experts today with us who are talking about wheat disorders. Those people in India who are Vedic sciences and Vedic medicine know that in India there is a disease called Anna Dosh. Anna basically means wheat, Dosh means disease. So our Vedas and our Ayurveda, the traditional medicine, talks about a disease which is related to Anna. And when we read about Chandogya Upanishad in great detail, Prasandha Upanishad and Chandogya Upanishad, it does talk about that our immunity, our semen is made out of millets. It doesn't talk about wheat. It does talk about in great detail about more consumption of millets. Wheat it talks about rice and millets. It doesn't talk about wheat. Maybe our ancient Rishi Munis knew that wheat is harmful for health. And second thing, they brought out that we should fast 80 days in a year. That means once in a week fast, one extra on the day of Ekadashi, and then 9 days fast in a year. And in all days of fast in a year, you are supposed to be on a diet which is gluten-free and a diet which is belonging only to fruits, whether it is black wheat, whether it is any type of a rajgiri, whatever we eat, it is minus wheat. Maybe that was the reason that insulin resistance was not there in our country. Maybe that was the reason that diabetes was not an epidemic form, the celiac was not in an epidemic form. If we have 1% of the patients having celiac, that's a disease. But wheat sensitivity, if it is affecting 20% of the population, I think somehow or other it is in our genes and we need to talk about it. So what we have listened from them is that if you have unexplained sickness, if you cannot diagnose, you say, I don't know, before labeling them as putting them on antidepressants, always talk to your doctor. Can it be a sensitivity to wheat or a gluten of some kind? Whether or not your tests are negative, even if your tests are negative, always ask your doctor, can this particular unexplained symptoms be due to gluten sensitivity, wheat disorder, not or not related to gut. Even in cardiac heart diseases, if you find that you have aggressive atherosclerosis, think of it, because this may be exacerbating your deposition of cholesterol in the body. We thank both Tom and Ishi to be here with us, and maybe we will have one more symposium before your conference where we can have more people and ask more questions. That's all for today. We thank all of you and the public and the viewers for joining us in this Facebook Live. And if you feel that this was good, and if you feel that the symposium or the Facebook Live has given you some new inputs, share it with others, pass it on, share. You can keep asking your questions. We will forward it to both of them. They all will be connected and they will be able to answer your question. Thank you very much. We come back with one more webcast. Till that, goodbye. Thank you.
Bye-bye.